Hi, I'm Dr. Dafna Gladman. I'm a rheumatologist from the University of Toronto in Canada. And I'm here at the RWCS, and I'm going to summarize the lecture that I gave yesterday to the group here. And what we talked about was evolving concepts on systemic lupus erythematosus. The first evolving concept is that of comorbidities, which include a number such as cardiovascular disease, bone disease, both osteonecrosis and osteoporosis, and neurocognitive dysfunction, which is now becoming a major issue for our patients with lupus as they live longer. Some of these comorbidities are related to the medications that we give patients, particularly corticosteroids, and some of the comorbidities are related to the disease activity and the inflammatory process that is associated with the disease. Another evolving concept is the concept of criteria. So we've had criteria initially developed in 1970 based on some studies that were done by the then American Rheumatology Association, which is now the American College of Rheumatology. And then a subsequent study was done in 1982 where the number of criteria went down from 14 to 11, but still 4 of 11 were required for classification. In 1997, there was further redefinition of the criteria so that the LE cell prep was replaced with antiphospholipid antibodies. And then at the current, and then more recently, in 2012, the Systemic Lupus International Collaborating Clinic groups developed further criteria which had more face validity in that they required that at least one clinical and at least one immunological feature had to be part of the criteria. And in addition, if a patient had a kidney biopsy proven lupus nephritis and a serologic abnormality such as a positive ANA or a positive anti-DNA, then they could be classified as lupus. But that was not enough. Last year, the American College of Rheumatology and EULAR decided to revisit classification criteria, and stay tuned. There is now an attempt to further define criteria for the classification of lupus. The next issue that we covered was the idea of assessment tools, and these have evolved over the years. The most commonly used tools at the moment are the SLE Disease Activity Index 2K, which was developed in Toronto, and the BILAG, the British Isles Lupus Activity Group criteria that was developed in the UK. And those are most commonly used in clinical trials, but as we know, many of the clinical trials have not achieved their target, and the question is, are the instruments to blame or are the drugs to blame? And so further work is being done at the moment on developing the S2K Responder Index 50 and on flare indices in lupus, and so stay tuned for that. And finally, we talked about drug trials. As we know, only one drug trial actually achieved its target, that was belimumab, and it has been approved for lupus, but many other drugs have been tested and discarded, and other drugs are currently being tested, and so again, these are evolving concepts in lupus. The Rheumatology Winter Clinical Symposium, RWCS, is taking place in this beautiful island of Maui, and I would certainly recommend to anybody who is interested in getting knowledge as well as spending some time in paradise to join next year, February 15th to 17th in Hawaii.